Um, Good morning, everyone, and thank you for coming today. My name is Julian Juarez, and I live in Los Angeles, where I run the city's only transgender employment program for the LA Gay and Lesbian Center. This is such a historic day for our community. It is the first Transgender California Advocacy Day. Exciting and empowering day for us. We have gathered this morning to discuss some of the disparities faced by the transgender community in the areas of employment and healthcare, and some important bills that we would like to discuss with you today. We would like to discuss SB 543, which is the Minor Mental Health Consent Bill, and AB 1878, the Data Inclusion Act, which would allow for government forms to collect data on gender identity, same-sex partnership relationships, and gender expression on government forms. We would like to thank the Transgender Law Center, an agency that has been doing advocacy in behalf of the transgender community since 2002. So thank you so much for the Transgender Law Center. And we would also like to take some time to thank Equality California, the state's largest LGBT advocacy organizing agency. So thank you so much for being here today as well. One of the reasons that we feel this is so important is because if you take a look at the State of Transgender California report, you will see that 67% of our community faces employment discrimination. That has to end. That's a high number. 1 in 5 people in our community have dealt with homelessness, and the unemployment rate for our community is double what it is for most Californians. These are insurmountable barriers that we need to tackle now in order for our community to be empowered and gainfully employed. So that is why we are here today, to hopefully create that kind of change. So thank you all for coming this morning. One of the first person we would like to have come up and speak is Assembly Member Tom Amiano. Thank you. Tom Amiano is current chair of the LGBT Legislative Caucus and introduced the LGBT Prisoner Safety Act, which would require prisons to consider sexual orientation and gender identity of prisoners in housing decisions. He has also spearheaded San Francisco's Universal Health Care Ordinance and has helped many lower-income transgender people access care. So thank you so much, Tom. We are so happy.
Well, good morning. Welcome to the Capitol, and I hope you transform the legislature. You know, in 1969, I know none of you were born then, I lived at 16th and Castro, and in those days there was a bar that became then an after-hours place called The Shed, and we used to go down there and hang out. Show you how long ago we smoked cigarettes inside. That's a long, long time ago. And there were a lot of members of the trans community that used to go there too. We always had a wonderful time because, you know, it was the disco time, so the music was great, and, you know, we can bump and we can grind. But, you know, it was also very, very, very political because, you know, the members of the community were not welcome in other LGBT establishments. And one of the things I did is I belonged to an organization called BAGEL, Bay Area Gay Liberation. And Harvey Milk used to come to those meetings, and we used to picket the bars that would discriminate against trans people, against African Americans, against women, because we knew that within our own community there is a lot of prejudice and a lot of education that needed to happen, even amongst good people. So the good news fast forwarding to 2010, we're in a lot better shape in terms of we are on the radar. We are engaged in talks of public policy around transgender issues. Certainly up here, people like to ride the criminal justice pony, try to get a little bit more law and order, try to be punitive about things. I like to bring up the inequities in that, for instance, around assaults on transgender men and women. And I think of Gwen Araujo particularly, because that really is close to our heart in the Bay Area. So when we met with Nancy Pelosi about 2 years ago, we were pretty ripped, you know, about no transgender in ENDA. And I think we were very, very clear with her. And I think we've actually, you know, thanks to everything that's happening, that we've actually educated the Congress. And I think we are going to see an all-inclusive ENDA. And I'll go to D.C. with you and show you some of those disco moves when that happens. Anyway, good luck today. We've been able to move our transgender bills off the floor, then to the Senate, and then, unfortunately, to Arnold, who seems to have a blind spot about this. Strangely enough, after looking at some of the movies that he's made, that he's a little clueless about identity and things. So, thanks again for all your help. And, you know, my door is always, always open, no matter what time of day or night. If you have any problems, please feel free to call Senator Leno. No, you can call me.
So much for that. Our next speaker is Mateo Persons. He is the staff of the Transgender Law Center here in San Francisco and has been doing tireless work throughout the years to organize our community and empower our community. And we'll give you a brief summary of some of the programs that we had over the weekend at the Transgender Leadership Summit, which brought together over 200 transgender community members and allies to discuss some of these issues and strategize around some of these issues. So, big hand for Mateo Persons.
Thank you. I'm Mateo Persons. I'm the Movement Building Coordinator with the Transgender Law Center, and I can't be more proud to have joined a phenomenal team of transgender and ally leaders in California to really help organize the 5th Annual Transgender Leadership Summit. So I'm so proud of being part of the host committee and the planning committee, so a big hand for you all. The other thing is, the Transgender Leadership Summit is part of a legacy, a 5-year legacy now, that was started at the Transgender Law Center in order to develop professional advocacy and personal skills of transgender and ally leaders to make sure that we have access to affordable health care, access to employment opportunities, and access to participate in California just as much as everyone else. So I'm so proud to be part of this legacy and hope to make it continue in years to come. So thank you so much for that as well. And this weekend we had over 200 people continue this legacy by going to the summit at the UC Davis campus to learn about advocacy skills in healthcare, advocacy skills in employment, as well as how to build our movement with programs such as learning how to fundraise, how to develop our leadership skills, and how to build big communities and build teams where we all live in our hometowns. As well, we have now been taken to the streets now over the years in California to talk about our rights. We've been in community clinics talking to providers to make sure that we have access to health care, and we've been going to employers, making sure that employers have inclusive insurance coverages and also inclusive policies to make sure that we get hired at larger corporations as well as smaller businesses. But now this is the first time in history that we're going to go into halls of the Capitol, and make sure that our voice are echoing and that our legislators will never forget our faces. Our legislators will know that we're in their hometowns and will hear our stories for the first time in California history. And so I'm so proud of it. of a huge tide in California of transgender leaders coming into the Capitol, and we can't keep waiting for this work to continue in years to come as well. So thank you so much for being part of the Transgender Leadership Summit this year, and for being part of the first ever Transgender Advocacy Day here in California. Thank you.
Thank you, Mateo, for all the work that you've done and continue to do. Next, we would like to introduce to you Allison Laureano. She's a community member who has spoken with over 200 nonprofit and social service agencies on the importance of data collection for the transgender community. And she would like to share with you some of those points today. So, Allison Laureano.
So it's going to be kind of hard to follow Mateo with that round of applause and to talk to you about data collection. I mean, all of you in school, data collection, really? But, so my name is Allison Laureano. I'm on the board of directors of Transgender Law Center, as well as several other boards of transgender organizations. And I'm here to talk to you today about a little bit about data collection. But what I'm really here today is to ask the legislators if they have any idea how many gay, lesbian, bisexual, and especially transgender people that live, work, or do business in the districts and communities they represent. I have a feeling that they don't, because frankly, I don't believe that this data is readily available. One of the main issues that affect the transgender community is that we are overlooked in state programming because we are not counted in traditional data collection efforts. What this means is that we are less likely to get the services that we need developed in the communities that we live in, because the state, frankly, just doesn't know that we're there. I often joke that I have two full-time jobs. One that pays the bills and funds the other one, and the other one that feeds my passions for social service and equality. It is in this volunteer work and involvement in social service organizations that I find my passion for helping people. I know that through this work, the transgender community, though large, is often invisible. We seek the same opportunity to obtain the same services that others take for granted. It is a sad state of affairs that two of my best friends who are in the audience today are having difficulty finding jobs and adequate health care in this economy. Now, I know that that is not unique to us just being a part of the transgender community, but when the services that are available for non-transgender workers in the areas of employment and health care are readily available from our great state, while they are not for my community, it is an equity that I must try to find a way to help resolve. The simple fact of the matter is that these services are few and far between for our community. Though our state has some of the finest leaders in our legislature, they are simply not informed as to how prevalent our community is, nor how lacking the services there are for us. Now, as an information technology professional, I was tasked during my career in the healthcare industry to create data compilation efforts from our consumers. I recognize the importance of gathering vital statistics about our patients and consumers in order to determine the types of treatment programs and regimens required for their needs. It was only through these efforts that we were successful as a business, as evidenced by our positive patient outcomes. Now, I believe that this model transcends to California being successful as a state in providing the needed services to its transgender residents. Just as I could know that some of our consumers have special needs due to types of nutrition, support systems, drug regimens, and health conditions they had, so could California know and determine what needs its transgender residents require in the areas of healthcare, education, and employment. In conversations parallel to this issue, we know that these needs are different, and the only way that these needs can be met is if they are recognized as needs in any one community. We now know, as I realized then, that a complete and accurate demographic profile is required in any provision of services. Our state cannot know how its LGBT community utilizes its public services because they just don't ask the question. We as a country, this very year, are undergoing our 10-year constitutional requirement of a census. The goal of this is to determine the makeup of our communities so that we can accurately provide for representation in government and allocation of resources needed for public services. Currently, we can know what ethnicities make up the community, what religions are practiced, and how old they are, and whether or not they are married men or women. What we don't know is if they are members of other protected classes, such as sexual orientation, gender identity and gender expression, or engaged in domestic partnerships. So what I'm asking today is that our state leaders move forward Assembly Bill 1878. We expect this bill to be of minimal cost, yet of high impact in resolving the needs of many of California's residents. It is time that California take a lead in ensuring equity amongst all its residents. In this bill, California Statewide Forms Management Program will be directed to add the questions about sexual orientation, gender identity, and domestic partnership status in the voluntary demographic section of California's government forms. Once this is done, more complete data can be obtained to help the state deliver the right level of services to any community. Once this is done, the state can ensure that transgender Californians receive the services they need to thrive. Now, I urge the California legislators to join me in support of this bill so that all Californians, straight, gay, lesbian, bisexual, and especially transgender, have the opportunity to live in the same comfort and safety with equitable participation in the services that they need. Thank you.
Thank you so much, Allison. Thank you. Next, we will have Wendy Hill, who is the new Executive Director of the Sacramento Gay and Lesbian Center. Wendy will share some of her personal stories with us, as well as going over some of the programs that the center will have to address some of the issues of employment and health care. And she will also give us a quick call for legislators to focus on the same issues across the state. So thank you.
Thank you all so much. Again, my name is Wendy Hill, and I am the newly appointed Executive Director of the Sacramento Gay and Lesbian Center. I am humbled and honored to be here today to talk with all of you about the transgender community and the programs that we have here at the center. And I'm mostly humbled and honored to be here because for those of you that know me for years, many of you have been walking by my side in these halls on issues of marriage equality and gay and lesbian issues. So I am humbled and honored here today to be with you and walking these halls on issues of the transgender community. There are people in the LGBTQ community here in Sacramento who would say, why do you as a lesbian mom care about transgender issues, and why is it important for you to advocate on behalf of transgender issues? And I have to tell you that the reason why these issues are so important to me is because when I was 19 years old and I was volunteering at a nonprofit agency for queer youth, I had an executive director mentor who knew how important it was for all of us in our community to understand each other's issues. So as a peer counselor volunteer in that organization, he assigned me my very first client, which was a 12-year-old identifying boy who was a transgender boy who was in the foster care system in a co-ed group home. I was 19 years old, armed with 12 continuing education units, walking into a co-ed foster care group home, trying to understand policies and create policies on what dorm does he sleep in. Do we encourage makeup, or is somebody going to get fired by doing things of that nature? There were so many questions and absolutely zero policies whatsoever that were for queer youth in the foster care system. So I made it a part of my career in advocating to learn about everything that was happening in our community and make sure that everybody in our community understand each other's issues. At the Sacramento Sacramento Gay and Lesbian Center, we have done what many centers across the state have done, and we've created some terrific programs that provide support to the transgender community, people who are questioning their gender identity, people who are transitioning, resources, legal resources, health resources, and I am so proud of those programs that we have here in Sacramento at that center. I am so proud of how inclusive this Sacramento community is of the transgender community in our greater Sacramento region. But it's not enough. And as the new executive director at the Sacramento Gay and Lesbian Center, I think that we're at a time where we need to mature past just the support groups and move into the actual true advocacy that the transgender community and the LGBT community needs. So, starting this month at the Sacramento Gay and Lesbian Center, we are creating a Speakers Bureau. And in that Speakers Bureau, we are going to design specific professional speakers on the trans community. Our very first event is next month. And next month, we will be speaking to the employees at TSA over at the Sacramento airport about gender identity issues. Not only do the transgender employees at TSA have their own employment discrimination issues to deal with, particularly being employed by the federal government, but TSA employees have no idea what to do when a person of the transgender community comes through and needs a pat-down. Do we go to the male assist or the female assist? The Sacramento Gay and Lesbian Center is moving beyond just traditional support, and we are now moving into community education. With regards to healthcare, this week is my second week on the job. Yesterday, on day 2, I walked into the center and there was a gentleman that was sitting on the steps of the center. He had nowhere to go. He had just been to Planned Parenthood to get some medication, his hormone treatment that he needed on a regular basis, and he had been denied, and told that in order for him to be able to continue getting his prescription, he had to go see a doctor and get a referral and get paperwork filled out, and he had absolutely no idea where to go. That's absolutely not acceptable for the Sacramento community. So, beginning next month, we are going to put together a group of people that are going to help put together a healthcare resource manual for the transgender community here in Sacramento, so that the next time somebody comes to the center and needs some assistance on where to go for gender counseling, for hormone treatment, for a physician that understands how to use the correct language, we will have those resources available for the people in our community. As far as data inclusion goes, I can't tell you from the perspective of a non-profit executive director who relies on grant funding how important it is for us to be able to enumerate the people in our community. It's impossible for us to apply for funding without having that funding specifically set aside for our community. So including requiring our state to collect our important data so that we can bring those funds back into our households is the most important thing that we have to move forward with in terms of data collection in this state. And finally, minor mental health services. I can't tell you, I actually have to tell you a little personal. This particular bill was actually a bill that I helped to create last year under my previous job, which was the Director of Government Relations for the National Association of Social Workers. I can't tell you how important it is for us to remove the barriers that currently exist to providing preventative and early intervention to our queer youth, particularly our transgender youth. To require a transgender youth who has questions about gender identity, who doesn't have the words or the language to even express how they're feeling, to ask for their parents' permission to receive mental health services is absurd. We are losing children every single day in this state. We are losing them to suicide, to drug abuse, to promiscuity, to homelessness, to all of these terrible things that we're spending millions of dollars on to try to prevent because we have this barrier that requires parental consent. By the passage of Senator Leno's minor mental health consent bill, these youth will be able to come to us, get treatment, get the language, and we can help them communicate with their families on how to best move through this process. I want to thank you all so much for being here today. This is so important that you are here, and I hope to see you here, and I will be with you here year after year, but don't let today be the last day this year. We have to go out there. We have to continue to educate. We have to continue to tell people our stories. We have to continue to express why it's important that we move forward and why we matter in this great state of California. Thank you so much.
Thank you, Wendy, for such an energizing speech. I loved it. Thank you. Next, we would like to introduce to you Christina Worth, who is the legal director for the Transgender Law Center and is a driving force behind a lot of the work that we are doing here today. So let's give it up for Christina Worth.
I gotta pull this way down after this. Thank you all so much. Such an exciting day. We are making history. Our voices are echoing through the halls of the Capitol, and I couldn't be more proud of all of you. You're so ready to go out there and do some lobbying. So congratulations on that. While we're here today primarily to talk about jobs for the transgender community, healthcare access, to talk about mental health access for at-risk youth, and data collection, we would be remiss today if we didn't mention the sad state of affairs with the California budget. It is incredibly sad what the governor has proposed that we cut. There are tremendous, tremendous cuts to social services, and our community relies way too heavily on social services sometimes, and without those vital social services, we're losing lives. 1 in 5 transgender Californians has experienced homelessness since they've transitioned. Look around the room. 1 in 5 of these people have been on the street. Without vital social services for our community, we're losing lives, we're losing people to suicide. Just like Wendy was saying, we're losing people to drug abuse. It is a tremendously sad state of affairs when we can't keep our own communities alive because the state isn't prioritizing social services for us. So in addition to going out there and talking to your legislators about jobs and healthcare, data inclusion, and mental health access for at-risk youth, I urge you all to mention the budget and let people know that we will not stand for a budget that kills our brothers and sisters, that disproportionately affects our transgender sisters of color. Thank you so much, and enjoy the day. Go out there and do some good advocacy.
Alrighty. Next, we would like to introduce to you Ted Lieu, who is author of the AB 1878 Data Inclusion Act, which will add voluntary questions of sexual orientation, gender identity to the state's forms to improve government-funded programs for trans people. In 2009, he introduced the Equal ID Act that would have allowed transgender people born in California to return to the county of their birth to obtain corrected birth certificates. Unfortunately, Governor Schwarzenegger vetoed that. So, thank you so much, Ted.
Thank you. Good morning. I'm honored to be carrying my second transgender law in a row. Hopefully we can... Let me tell you why this bill, Assembly Bill 1878, is so important. As all of you know, members of the LGBT community are often at higher poverty rates than other folks in the community. And there's several reasons for this. One is just a very simple reason that in California, for instance, you're not allowed to marry. if you have that status. The problem is folks get discriminated against based on the way Social Security regulations are written. If you are in a domestic partnership, you do not get the same benefits from Social Security that a married couple does. If you are a LGBT member, you're and open about it, you're unlikely to join the military, right? There are certain job opportunities that you will not have access to or be involved in. And as a result, poverty is at higher rates in the LGBT community, and we don't really have a good method of tracking that. This bill will help track that, plus other information, voluntary information, if someone wants to give it, from the LGBT community. And that is important because it gives policymakers the data from which we can then make decisions on how to target very scarce government resources. And that's why this is such an important bill. And it's also important to get LGBT members more recognized within California data and California forms. And it's the first bill of its kind in the nation. I'm very honored to be carrying it and look forward to working with all of you to get this to the governor's desk and hopefully to get it decided. So thanks again for everything.
Thank you so much, Ted. Next, we will hear from Sarah Rogers, who is the legislative assistant to Senator Mark Leno, who, while he was on the San Francisco Board of Supervisors, introduced and worked for passage of a health care plan for San Francisco city workers that covered trans-specific care. That's amazing. Has also introduced and worked for passage of a bill banning discrimination based on gender identity and expression in housing and employment, and is the author of SB 543, the Minor Mental Health Consent Bill. Thank you so much, Sarah.
Thank you so much for allowing me to come and present to Senator Leno. He's stuck in an appropriations committee right now, otherwise I know he would wish to be here. As you know, there are huge barriers to youth in California receiving access to very basic mental health care treatment, and one of those is parental consent requirements that pose significant barriers if their parents are unable to be located, if the child does not feel comfortable bringing that information to their parent, and delaying access to these very basic healthcare services is truly detrimental to the outcomes and to the mental health care services that every youth, every Californian needs. So what this bill would do is remove the parental consent requirements in very limited instances when the professional has determined that the youth is of sound maturity to make that determination for themselves, and then the provider has the capacity to treat that patient immediately rather than requiring the student or the youth to go to do things that they don't feel comfortable doing. So Senator Leno feels like this is an extremely important advancement in access to mental health care. We're moving very hard on the bill, and it's in the Assembly right now. In addition, he's the author of universal health care legislation that would ensure that every Californian has access to basic health care, and is the only way that everyone in California will have access to both mental health care services as well as other physical health care services. So I personally look forward to working with you in the future, and as does Senator Leno, and SB 543 will be moving forward to the governor's desk hopefully this year. Thank you very much.
Thank you, Sarah. Next, I would like to introduce to you Mr. Daniel Gould, who is the Health Network Coordinator for Equality California, the state's largest LGBT advocacy agency. He will give us a brief overview on of our health network, mental health bill, and mental health project. So, Daniel Gould, thank you so much for being here today.
This is really just amazing. I have to say, I never thought I'd see a site like this. Not only am I here I'm not only a professional in terms of doing trans work, but I am also a trans man, and it makes a difference to not only be able to do this work on a professional level, but to
but to connect with people personally and see what a difference it makes on a daily level for everybody here. As Drian said, I coordinate the California LGBT Health and Human Services Network, which is a project of Equality California. The coalition is a group of LGBT providers, researchers, and community centers across the state, from Eureka all the way down to San Diego, working together to advocate for state-level policy and state-level funding that's going to advance LGBT health. And let me be clear that when our network talks about health, we mean health broadly. So health is housing for LGBT seniors, it's safe schools for LGBT youth, it's legal advocacy for transgender people, it's support for our LGBT families, and it's also medical care that's appropriate for LGBT people. I think trans people have particular needs about health and human services, and some of those you've heard about already today mean mental health. Our network is focusing specifically this year on mental health because of the serious and profound impact that stigma and discrimination have on mental health for our communities. So we are asking our legislators to support SB 543, the minor mental health consent bill. And I want to tell you a little bit about the story of one of the young people who inspired this bill. A young trans woman called for counseling services at a small local community service center. She was depressed and seriously struggling, but she was not yet suicidal. But she was aware enough to know that things did not have to get worse, that with the right help, her life could be better, that she might be able to do really well in school and improve her relationships and feel happier. But her parents did not support her getting any kind of counseling for anything. She asked them, and they said no. So the providers, even though they wanted to take care of her and would have liked to have helped her with her depression, had to say, I'm sorry, we can't help you. They had to turn her away because you're not suicidal. She had to wait until it would get that bad. And we don't know what happens to that young person, unfortunately. To me, that's incredibly sad. But SB 543 would change that situation. It would make it so that even without her parents' consent, she could be seen for services, for mental health counseling, and get support and learn what are the ways you can be a healthy transgender woman. And she could learn that without having to get to a point of utter desperation. This bill would transform lives. It's good policy for all of California's youth, because it doesn't just apply to LGBT youth, but it is particularly good policy for our LGBT youth and for our transgender youth. We know that right now in the budget cuts, it's a tough time because services are being cut. We don't believe that there's a cost associated with this bill. The services are already there. We're not asking for new programs. We're just asking for our young people to be able to access the programs that already exist. So we think the cost for our California young people and families is just is so much more, and it's too much to not be able to provide these services. So we're excited to be supporting SB 543, and we're excited to have all of you advocating with your legislators today about this piece of legislation. The network is also focusing on mental health in one other way. Our significant work this year is going to be focusing on our LGBTQ Mental Health Reducing Disparities Project. It's kind of a long name. The network is doing this in partnership with Mental Health America of Northern California, and we're going to be forming a strategic planning work group, and we will, at the end of our 2-year project, have a report in hand that the State of California Department of Mental Health will be using to shape mental health services for LGBT people. So we are going to be going throughout the state, meeting with people in your communities
finding out from providers and LGBT people what makes good mental health, what do you need, what's going to work. And this will be a way of transforming the existing public mental health services into something that's actually LGBT affirmative and that actually helps our communities. That's huge for us. We really need to have that. And as a provider, I want to talk a little bit about the budget because that's a project that's funded from the Mental Health Services Act, which is not, we hope, going to be cut because that would require the voters to make that change. That's not something that the legislature can touch in terms of a funding stream. But as a network that's really focusing on funding issues at the state level for LGBT health, some folks have said, well, what kind of advocacy can you do right now? Because, the state budget is pretty miserable. But getting the data collection going for our communities, and AB 1878, it's part of a long-term strategy to get funding for our LGBT organizations. The budget is horrible right now, but it will not always be horrible. If we can start collecting some of the data now, in 2 years, in 3 years, when we start to dig ourselves out of this hole, we will have some numbers and some ways of quantifying and talking about what our health needs are. And going to our state then to say, this is what we deserve and this is what we need. It's an exciting opportunity. I know some people don't think data is exciting, but I think it's an amazing and exciting thing, and I hope you all can talk about it with your legislators in ways that are just inspiring and get them passionate about supporting that bill. So that's the primary focus of our network this year. We look forward to being able to tell you more about our network work in terms of supporting LGBT health this year, and we are so excited to be a partner and to be supporting the Transgender Law Center in the first annual Transgender Advocacy.
Thank you so much, Daniel. In closing, I would like to present to all of you the Executive Director of the Transgender Law Center, Mr. Mason Davis.
Thank you all so much for being part of this historic day. It is incredible to see a room full and overflowing of transgender and gender nonconforming Californians and allies taking to the Capitol today to educate our policymakers about the importance of healthcare and jobs for our community. Thank you for being a part of it. It's been absolutely incredible to hear all the powerful testimonies today. And it's been quite a day. I've never seen so many people and trans folk at the Capitol. It's exciting. I'll tell you, when I first came out as a transgender man, I took for granted that many of my transgender brothers and sisters would experience job discrimination. Before I transitioned, I really had to come to terms with the fact, I thought, that when I actually came out as a transgender man and told people I was going to transition, that I would likely lose my job, my family, and my livelihood. That was just over a decade ago, and we had absolutely no state protections in California. I could be fired merely for coming out as a transgender or gender nonconforming person at the time. Today we have good laws that say that that can't happen. That's great. I can now be out and proud as a transgender person like others and not risk discrimination. And yet, today, we know that 67% of transgender Californians report that they've experienced discrimination on the job, even with good laws. We know that transgender Californians are twice as likely to experience poverty compared to other people in this state, even with good laws. And we know that transgender people are twice as likely to be unemployed. In fact, only half of us are working full-time. Incredibly horrible disparity compared to others in the state, and that's with good laws. Nationally, the Transgender Law Center and many other organizations are working hard to pass a federal Employment Non-Discrimination Act. And I am confident that that bill will pass and that we will have national protections that will influence corporations and the treatment of transgender people throughout the globe. Here in California, though, we have that good law in place, and yet it's not working for many of our community members. We have to do better. I want to urge the state of California and our workforce development providers to take on the issue of unemployment and poverty within the transgender community. We need good programs that actually help us create pathways out of poverty for members of our community. We need to make sure that we have equal access to good jobs so that we can take care of ourselves, our families, and our communities. There are some great programs right now in California. There's a program in Los Angeles, there's a program in San Francisco, specifically to meet the needs of transgender job seekers. And yet right now, these programs are under attack because the federal government and the state government does not prioritize the needs of gay, lesbian, bisexual, and transgender workers. At this time, especially given this economy, we must prioritize the need of job seekers. The state needs to be investing more money into employment programs, not less. And yet, just this week, we saw with the governor's new budget, cuts to CalWorks and other essential employment programs that we need. We have to get California working again. We have to get transgender Californians working again. I urge you, please do everything you can to change our workforce development system so that it's meeting the needs of all California's workers, and to make sure that the state comes through on its promise of non-discrimination and equal access to all by prioritizing the needs of gay, lesbian, bisexual, and transgender workers in all of its funding sources and all of its programs. Thank you all so much for being a part of this change, for being here today, for speaking out, for spreading the word, and making sure that we have a better tomorrow for transgender Californians.
All right, everybody, we're all set to go out there and do our advocacy visits, and have a great day. Thanks for being here.